Om Shanti. A very good evening and warm welcome to Shanti Sarovar for today's refreshing Sunday evening talk regarding comprehensive eye care. So this topic is something very related to our physical health, and we have taken in the past more such health topics as well. So our today's topic will be taken up by an esteemed and expert speaker that we have from Vision Eye Hospitals, and she is Dr. Nimisha Sharma. So I'll give a brief introduction about her. So she has completed her MBBS with a gold medal, and she was awarded the prestigious MGM Blue Award for achieving first rank in entire MBBS. She completed her post-graduation from Shankara Netralaya, Chennai, and was awarded the DNB Ophthalmology. And her post-graduation, and she completed her fellowship, Rise Glaucoma Fellowship from Narayan Netralaya, Bangalore. Apart from this, she has completed various other fellowships which make her an expert in glaucoma as well as cataract surgery. She knows various techniques and has been serving in Vision hospitals. Prior to this, she has also served in other institutions such as the Narayan Netralaya and Vasan Eye Hospitals in Bangalore. She has won various awards at national and international conferences and has presented papers at international conferences. So we would like to invite on stage Dr. Nimisha Sharma to give us more insights how to better take care of our eyes, which have kind of become overused in this digital age. So Dr. Nimisha, welcome on stage and welcome to Shanti Sarovar.
Hello, thank you so much for inviting us here today. So I will be talking a brief about comprehensive eye care and my specialty glaucoma, which very few people know about. So first I would like to tell you, maybe some of you will think that eye is a very small part, and that is why most of the time it is like people ignore it. So first, some interesting facts about eye. Eye is the second most complex organ of the body after brain, and it makes a direct connection to the brain through the optic nerve. It's made up of 2 million working parts, and it contributes to 85% of our knowledge. So why so? Because whatever we perceive, our brain will process it much faster. Human eye can detect 10 million different colors. So, and one more important thing, nowadays you must be aware about the iris scan. They are more secure than the fingerprints. Why so? Because there are 256 unique characters in our iris itself. I'll come to the iris part, what exactly do we mean by iris, as compared to the fingerprints, which have approx only 40 characters. So being nearsighted, that is myopia, that means the minus number, or a farsighted, depends on your eye shape. And the eye blinks itself to remove the dirt and also lubricates the eye. So that is a normal, natural mechanism of eye to keep it more clean. So basically 80% of all vision problems can be prevented or cured. Just that a comprehensive eye checkup and an early detection and treatment should be done. So what do we mean? Again and again we are saying comprehensive eye checkup. What do we exactly mean by a comprehensive eye checkup? So it includes these steps. So when you go to an eye hospital, so the first checkup whenever you go to eye hospital is done by an optometrist, which include the first picture, autorefractometer. So in autorefractometer, this thing, we through a machine we get a rough estimate of your eye number, and a non-contact tonometry through which we get a rough estimate of your eye pressure. So like how we have a normal body pressure, similar thing, there is something called as eye pressure. So a rough estimate for all patients is done by autorefractometer. Then the patient goes to refraction. That means your number is checked by the optometrist. After that, ophthalmologist checkup is important. So ophthalmologist checkup is done by these two machines, which is called as slit lamp biomicroscopy, which checks from front part to the back part, all parts of the eye. And when we put dilating drops, we do by indirect ophthalmoscopy, we do a complete detailed examination of eye from inside. So all these are done by ophthalmologists. So people are like not aware about a complete checkup. Most of the people who come to us, they tell we keep getting eye checkup done by, like we have got our eye checkup done. When we ask in detail, they'll tell maybe by an optometrist or an optical shop. So only the first two steps are done at the optical shop, not these two, detailed examination. So this is what is a comprehensive eye checkup. So most of the problems like in eye ranging from front to the back part of the eye, there are 80% of them are non-symptomatic. That means patients won't have any complaints regarding that. Then whenever they come, or maybe in later stage, then they get diagnosed when they actually have vision problem. So why is it important? Same thing, because the eye symptoms, most of them are asymptomatic. Only very few emergency situations are there in the eye when the patient will actually have to run up to an eye hospital or an ophthalmologist. So the thing is, from front to, like when you see eye from outside, you do see a colored part in the eye that is called as iris. That is what I was telling you that it has different characteristics. Nowadays the iris scans are there. The black part in the eye, which is pupil, and the white is the sclera. So that is just what you see superficially from outside. But if you take a cross section, we do have the front part, transparent part called as cornea. Then there is a lens which develops later. Everybody gets a cataract, you must be aware. So then the inside part, which is the main sensory organ of the eye, that is called as retina. So, and there is an optic nerve, that is the nerve which connects to the brain. So each eye has its own optic nerve which gets connected to the brain. So ranging from first part to the end part, the thing is anything can get affected. So people generally won't get to know about the eye problem. Now, the most common age-related cause of decreased vision is cataract. So through a small video, I will just show what exactly is cataract. Yeah, so the eye parts, what I was telling you, see, this is the colored part which is iris. This is the black part which is pupil, and the sclera. So from outside you see only these. When you take a section of it, you can see different layers of the eye, which is conjunctiva, cornea, then the lens, crystalline lens, where do we get cataract, and this is a jelly inside eye in which also problems can happen. This is the retina, which is the main sensory part, and this is the optic nerve which connects the eye to the brain. So most common age-related cause of decreased vision is cataract. So your eye is like a ball filled with water, like a fluid. So light enters through this transparent part, cornea, and it focuses on the retina. So the focusing part is the lens, which acts as a camera lens to focus the eye from the front to the back part of the eye. So lens is mainly made up of water and protein. So as you age, the proteins in the eye will change, and the crystalline lens, which is clear in the beginning, as you age it becomes opacified. So basically it hampers the entering of light to the retina, which is called as cataract. So as you age, when the opacification happens, the thing is we have to remove the cataract and put a crystalline lens. So what are the signs and symptoms of cataract? How the patient will get to know about the cataract? So cataract basically leads to blurring of vision. Blurring of vision means you start seeing a little dull or a faded colors. Some type of cataract patients do feel glare. Whenever you go in light, it will be very difficult to open in bright light. Sometimes double vision in one eye, blurring of vision. Whenever you need to read for near, you need to read in a good lighting. In dim lighting, it will be very difficult. So basically, all these symptoms will depend on the cloudiness of crystalline lens. So that is called as cataract. Everybody might have different symptoms depending, because every human body is different. So wherever the cataract has started in the lens, depending on that, symptoms may change. So this is all about cataract and a normal eye structure. So coming to my specialty, which is glaucoma, which I was telling you, there are approx like 2 crore people would get affected due to glaucoma in a year. What is glaucoma? Glaucoma is basically a damage to the eye optic nerve. Optic nerve is the nerve which connects eye to the brain. So this is a normal healthy eye which maintains a normal intraocular pressure, that is the normal eye pressure. Slowly in the front part of the eye, when the pressure starts increasing, this part, it creates pressure on the back part of the eye and starts creating pressure on the optic nerve, which causes damage in the optic nerve. This is called as glaucoma. So why glaucoma is giving, like nowadays, because we have so much new technologies coming up, patients generally won't have symptoms in glaucoma. 80% of patients are asymptomatic. When they come for eye checkup, we check them and get to know that they have glaucoma. So why so? Glaucoma is a leading cause of preventable blindness, and 90% of glaucoma is undetected. 40% vision loss will happen before one becomes aware of it. So basically, before that, patients will not get to know anything. And the thing is, basically in glaucoma, it starts affecting the side vision. So some patients won't even feel. Some may feel like while driving, we don't feel like car. Sometimes when it crosses, they won't appreciate that. That will be their primary complaint. But most of the people who are at home working normally, they won't have all these symptoms also. So this is again a small video for glaucoma, just telling a brief about glaucoma. So glaucoma is called as silent thief of sight. I'll explain why so. So glaucoma, if left untreated, can lead to a permanent blindness. 8.54 million people get blind due to glaucoma worldwide, and it is expected to keep growing because of the stress and other factors. So glaucoma can be compared to a cycle tire. Why so? Because like how you need to maintain a particular pressure in the cycle tire to keep it going, same thing for the eye. You need to maintain a particular eye pressure. Okay, otherwise if it is more or if it is less, both are harmful. Yeah, sure. You can't maintain. You have to maintain a normal intraocular pressure. That also will vary between every individual. Suppose if between 10 to 20 mm of Hg we tell when we measure, I will show you how we measure the pressure also. That is a normal eye pressure to maintain a normal nerve. But it may vary because there are different varieties of glaucoma. Some patients may have nerve damage due to glaucoma even at normal pressure. So for them, between suppose 20 or like borderline pressure will be high for them. So I will explain you how we treat glaucoma also. We have to reduce their eye pressure. How BP is more, so it will be harmful for you. Same thing for the glaucoma. We have to reduce the eye pressure to keep that nerve damage stable. It should not increase further. I'll explain you everything in this. How many of you are actually aware of the term glaucoma, or in Hindi we call kala motia? Motia bind is cataract. Kala motia is glaucoma. That is what, see, the proportion of people who actually know about the problem. First cause of blindness or decreased vision is cataract. But permanent blindness it will cause. It causes an irreversible nerve damage. That is glaucoma. So that is why nowadays we have these glaucoma awareness week programs and glaucoma awareness campaigns to make people get aware and come for an eye checkup so that they get diagnosed early. I'll play the video and in between I'll pause and show. I think there's some audio problem. So this thing I have already told, it's just repeating once. So basically the number of patients who come for the glaucoma are more. the thing is, sir, one is age-related cause. Then it can be related to family history, like how you have BP, sugar, diabetes running in genes. Similar thing is for glaucoma. Sometimes there can be no cause for glaucoma. Sometimes it can be because of misuse of steroids. These are some secondary causes. Some other causes can be like patients who keeps getting inflammation for some reason in the eye. For them, the eye pressure can start increasing any point of time. And also injury to eye, like some people, if they have any eye injury or head injury, they can develop glaucoma ranging from 1 month to 10 years, any time during that time. So there are various factors. We have to take proper history, and like most commonly what patients we see are like mostly without any cause or family history of glaucoma. That is a very significant thing, like crowd we get for glaucoma. And also depending, one type of glaucoma is where the eyeball structure is very like small. So those eyes also can get glaucoma at an early, like or after 40. So after 40, we advise every individual to come for a regular eye checkup, so that when we see clinically, we get to see any nerve damage. Sometimes the eye pressure can be normal, but they have the nerve damage, and we have to rule out what is the cause which is causing that nerve damage, and accordingly treat it. Glaucoma, so near and far is for the eye number. Okay, people who have smaller eyes, they have plus number. So they are more susceptible to getting one variety of glaucoma, which is called as angle closure glaucoma. So that is how. And even people who have high minus number, they are also more susceptible for another variety of glaucoma, that is called as open angle glaucoma. That is not under a high, it is mild myopia. But yes, we have to rule out other factors. And as I showed you, that slit lamp examination, when we see your nerve clinically, we rule out any cause of glaucoma, and other factors also we have to rule out. Sometimes previously patients will be unaware of the family history also, because some people, like in their it can skip generations also, not necessary their parents or anybody had glaucoma, maybe grandparents had blindness. When we go and ask history, that we get to know. It doesn't affect, it is not related to your eye number. Is spherical. Yes, spherical. They are different. That is a part of refraction. But it's just about the eye structure. Not everybody having a minus number will get glaucoma. Not everybody having a plus number will get glaucoma. Okay? Sorry? But you have to come for a checkup and see. Sir, actually preventive thing is early diagnosis. And if suppose glaucoma is diagnosed, then we start the treatment for glaucoma. So whatever treatment we start, it basically halts the progression. Basically, it will stop the glaucoma for progressing further. That is what is there. Whatever damage in the nerve will happen, either because of glaucoma, or maybe you must have heard, if suppose somebody has an eye injury, they get damage to the nerve. Once the nerve fibers are damaged, it is permanent damage. So that is irreversible. Yeah. Sir, daily habits, basically nothing that will be related. It's mostly like if genetic factor is there, it may happen. Other thing is like eating healthy diet, doing meditation, it does help, because like some studies have shown that yoga, getting that in your practice, that might help. Avoid doing some glaucoma patients, when they we ask them that some yoga asanas that should be avoided. Eye exercise won't help. Eye exercises won't help. It's just maintaining, like how you maintain your blood pressure, similar thing, eye pressure, but you can't do anything about it. If it is increasing, you have to give medication and reduce it, nothing else. And come for an eye checkup. If suppose early it is increasing and any nerve damage is there, then we can control it with medication. That is the first line treatment. So what is glaucoma? Same thing what I told you. It is damage to the optic nerve, and it causes an irreversible loss of vision and blindness. So who all can get affected by glaucoma? Glaucoma can be like all people, all age groups. Even we get to see people at like congenital glaucoma, that means from birth also it can be there. So that is like on checkups, when generally the pediatrician will send the patients when they see any changes in the eye structure or anything. So it can happen to any age group. So this is just a brief telling about what races, like Asians are very susceptible to getting glaucoma. So again, the family history, medical risk increases the incidence of glaucoma. So mostly there are no symptoms for glaucoma. So it's called a silent thief of sight. So basically, early treatment, early diagnosis, and then treatment is a thing. So why is it called a silent thief of eye? Because same thing what I told you, patients will be unaware. They won't have any symptoms, and it affects the peripheral vision in the initial stage. So generally patients won't be symptomatic. The central vision gets affected in the last stage of glaucoma, when the damage already has happened, like 90% plus. That time the central vision will start getting affected. So now, yeah. That is what it can be diagnosed when, like on a clinical examination only. Yes, so diabetic retinopathy basically can cause glaucoma. That is called as secondary glaucoma. Patients who have diabetic retinopathy, they may develop like few varieties of glaucoma. So diabetic patients also we advise for every 6 monthly or 1 yearly checkup accordingly. So we do check for glaucoma. That is what I was telling you, that non-contact tonometry is a screening test for eye pressure. We do for all patients, and when we check clinically, we check nerves for all patients along with the retina. Okay? Not particularly, but some problems in the retina can cause secondary glaucomas. Some variety of glaucoma, like suppose if the retina gets affected due to diabetic, or some patient have vein occlusions in the retina, they can get one variety of glaucoma called as neovascular glaucoma. So that is one aggressive kind of glaucoma which suddenly it can hike up. So we do follow up patients who come for a diabetic checkup or any kind of these problems for glaucoma as a secondary cause for a long term. That is what, plus 1.5, it is not related to number. Same thing what I told. Not every patient who has a plus number will get glaucoma, or any patient who has a minus number. Even I have minus number. So luckily, touch wood till now. So the thing is just we have to keep checking every time whenever you come. So, but it is not related. Sugar patient should have a diabetic retinopathy checkup. This can be an added thing. If suppose patients who have advanced diabetic retinopathy, they end up in certain variety of glaucoma. So we have to keep checking them. That is all. They are two separate things. I will show you. I have some pictures. Yeah. So once yearly regular checkup is a must. Suppose if we see some patient getting diagnosed, we'll do certain tests, and accordingly we'll start treatment. Then we tell them to come for follow-up accordingly. Suppose for medications if we start. But if you ask for a normal population, once yearly checkup is enough.
Next 1 year, so in between any symptoms, if it is causing something.
Yes.
So the minimum duration of it will affect like 1 month.
No, it won't affect in 1 month. See, there are if I can come to a little more medical kind of terms, there are two varieties of glaucoma. I'll just show you with this picture. So this you can see, this is a normal eye pressure. Like there is a fluid called as aqueous humor which maintains a normal eye pressure. So this part you can see, small thing, this is the drainage angle. Okay, so through which the fluid should flow in the eye. That is a normal mechanism in the eye which happens. Okay, so suppose any reason causing increase in pressure, that will create pressure on the nerve. Now this drainage passage, there are two varieties of glaucoma. One main thing is one open angle, one is closed angle. Open angle means the angle is open, but the meshwork through which the drainage is happening, suppose there is a sieve, it gets blocked. So the pressure will build up, right? that is called as open angle glaucoma. And suppose this passage, for some people it will be narrow due to narrowness in the eye structure. Suppose if that sieve, if you have some obstruction over it, so the fluid can't flow. That is another variety of glaucoma. So on clinical examination, when patients do come for checkup, some patients will be asymptomatic. Even the pressure is normal, nerve is fine, but they have that narrowness in the angle. For those patients, if we find that any symptoms during an examination that they need to come for a checkup, we ask them to come every 6 months or maybe 4 months. But if like open angle and no other thing is there, then we ask you to come for 1 year. Patients will not have any symptoms generally, but some patients can have increased frequency of headache. Okay, and even in like some patients, very few will notice colored halos. But that is in advance, like suddenly pressure hikes up, then only that is a complaint. General complaint is frequency of headaches. No, nothing related to vision, it will happen. So now you must be thinking that is it curable? So it is not curable. What I told you, that the nerve damage which happens, it is permanent. But it is preventable. If we diagnose it early, what we do with the early diagnosis and treatment, we will halt its progression. It will not increase further. So what sir was asking, how do we diagnose? Along with the comprehensive eye checkup, whenever we see clinically any changes in the nerve or the eye pressure, we check the eye pressure through a specialized machine called as tonometry. And then this is the specialized lens called as gonioscopy, which checks the drainage angle of the eye. What I was telling you, that whether it is open or closed. Through this specialized lens, we will get to know all these signs. And then with a specialized lens, we see inside the eye looking for these nerves. These are normal looking nerves. In glaucoma, certain changes will happen in the nerve, which we see clinically. And then we will tell patient, we go check the pressure. So this is done for all patients. But this applanation tonometry, gonioscopy for glaucoma patients or the patients in which we see any nerve damage or any narrowness in the angle, for them we will do. And then coming to the side vision, you must be thinking that again and again I am telling that side vision gets affected. So how do we test? There is a specialized test called as perimetry test. So that will get, it will test the side vision. So we will get to know in the scan that how much vision loss in the side vision has happened because of glaucoma. So these are certain specialized tests. And also there are certain scans in which we take picture and get the scan for the damage of glaucoma. So these are some specialized things which helps in early diagnosis of glaucoma. So the scan and the perimetry test will help in even before clinical also. Any changes in the damage, if it happens, we will get to know. Yes, sir. So when we put drops and check your nerves, no, we do see a picture like this one, this picture. So any changes in the nerve, that is one thing. And the eye pressure checkup, the first checkup when you do, that air puff will come. That is the eye pressure checkup. So correlating both the things, like 60% I would say will come normal only. But some patients might have increase in eye pressure in that. So for them, we will do all the tests, then dilate them. So for each patient, our approach for examination will change depending on the initial workup. Or suppose if some patient has family history of glaucoma. So for them also, we do all checkups every yearly, irrespective they have glaucoma or they don't have glaucoma. Yes, it does. Carrot is good, sir. It helps. It's basically beta carotene. It's help in strengthening the retina. Okay. Nothing particularly. Tablets won't help. It's just a balanced diet. And for some variety like age-related retinal degenerations, we do advise them for antioxidant. It may help to some extent, but basically it's an age-related process. Age-related cataract or retina problems, like how your hair will grow grey, similar thing it will happen. So it is not under control. It's just antioxidants will stop that progression. Okay. So coming to the treatment. So main thing what I told you, that in early glaucomas and the first line of treatment is drops which control the eye pressure. They are called as anti-glaucoma medications. Some variety of glaucomas may need laser. It's an OPD procedure, like for the angle closure, what I was telling, that narrowness will be there. For those kind of patients, we do a laser to open that passage a little bit. So whenever that narrowing is happening, there is an alternate passage which is created. And suppose for some patient with different combination of the drugs, the pressure will not get controlled, then we do the glaucoma surgeries. There are different varieties of surgeries which we have to choose according to the patient. It's not particularly one patient is particularly for this kind of surgery. Okay, but that will be our last option. First we try with the medical management. So coming to the take home message, basically a regular examination with an eye doctor, complete examination, not only the glass checkup, no. Complete examination including slit lamp and indirect examination is a must. Okay, even not particularly for glaucoma, even for a normal retina checkup also. So when we dilate, we advise every patient for a dilatation every once yearly. Some weak spots can form. It's not particularly after any particular age, it can happen at any age. So for a complete eye checkup, come to an eye doctor, get a complete examination done. Okay? And also some common symptoms which some people will ignore, like getting frequent headaches, watery eyes, watching close to TV, any concentration issue, not able to concentrate for long time, getting headaches frequently, eye rubbing, squinting of eyes, or not moving, eyes are not moving well, any increased sensitivity to light, eye pain, head tilting, all the closing of eyes or any white spots noticing around the eyeball. All these are some things which are ignorant and patients do visit us at later stage. So any problem in the eye, that should not be ignored. So please come for an eye checkup. And some basic tips for eye care. Same thing again and again I'm telling, that is a regular checkup. Proper lighting should be there whenever even like you are working on a screen or even working on mobile phones or studying or reading any book. Lighting should be adequate. Distance adjustment should be made. It should not be too near or too far to cause an eye strain. Blink more frequently. Nowadays there is something called as computer vision syndrome. So maybe you are not aware of the term called as computer vision syndrome, but most people who are using system more commonly, they must be getting eye strain at the end of the day, or redness in the eye, difficulty to open. They do complain that we have to close eye, wash our eyes more frequently. This is dryness basically. So the eye should blink every minute. Okay, so whenever you keep focusing on something, reading anything or seeing a laptop, particularly screens, the normal blink of the eye will reduce. That increases dryness. And you keep sitting in AC environment, that also is one thing which will increase evaporation, increase dryness. So what we advise them, follow a rule 20-20-20. That is, every 20 minutes, look away from screen towards 20 feet, like basically infinity, so that your eye muscles will get relaxed, and blink your eyes 20 times and then get back to work. Basically, voluntarily develop a habit of blinking more so that the dryness problem will reduce. The time when you end up to an eye doctor complaining all these, this will be a long-term thing. It won't happen like in 10 days, 15 days. It will take months to come to that level when you are symptomatic for dryness. So basically, follow this rule. Distance gazing, again the same thing. Look towards infinity. Reduce your screen time as much as possible. Nowadays, laptop, mobile. Most of the patients are complaining same thing. Even for the children. During COVID time, we are seeing lot of children getting same thing. Wear sunglasses whenever you go in bright light, particularly sunlight. And eat a balanced, healthy diet. That's all. It's in, we have 5 branches in Hyderabad. So the nearest to this place will be Gachibowli Center. It's before South India Shopping Mall. Sir, generally it is not related. Okay, but like cataract is one age-related change. As you age, the crystalline lens, which is a transparent lens, with age, because of the increase in protein, changes in protein, it becomes opacified. But glaucoma is different. It's basically increase in eye pressure, which causes damage in the nerve. But same thing what I was telling you with that diagram, I'll just show you this one. So as you age, what happens? Sometimes some variety of glaucoma can increase with the lens. So as the lens, that opacification happens, sometimes it swells in some people, which will cause that narrowing in the angle, which will hamper the pressure regulation in the eye. And also nowadays, generally, because people are aware, previously you might have heard people were like, whenever it gets complete cataract, total cataract, then we should get operated. That is also one risk factor. Patients who develop total cataract, they end up in more, like there are different varieties of glaucoma. For them, the risk factor for glaucoma will increase again, because the cataract has become swollen up big. No, not early stage. There are basically 4 stages of cataract. So when we clinically see, so from second stage onwards, actually speaking, nowadays because of advanced surgical thing, anytime we can remove cataract if it is giving you problem. Depends, like I showed you in one diagram also, different symptoms will come depending where you are getting the opacification in the lens. Suppose some patients do get cataract on the behind part of the lens. For them in early stages, we have to operate because it is causing them problem, like for the vision. So from second stage till fourth stage or total cataract, anytime we can operate. Depending, it's a planned surgery until unless it becomes a total cataract. Then we do tell patients that now you can't wait. Glare. Yes. So that is what I'm telling. They will get more glare. So people, suppose if somebody is retired or they don't drive more, they won't notice also. But somebody who is driving at night, they will be very symptomatic about it. So for them, we advise that we can plan to do a surgery so that they become symptomatically better. Also, the vision also will drop. That is also one thing whenever the cataract increase. So the clarity of the vision, the dimness, if you compare, because both eyes are separate. It's not that both eye will every time get similar cataract. So whenever 2 eyes are seeing together, the better eye will be a dominant eye. So they will be seeing it clear. But if you close one eye and see with the eye which has more cataract, then you realize that it is more dim. Yes, that we can do. Depending on your number calculation and everything, we can plan like that. So even there are different varieties of lens now which has come, that when we put, even for the near, you don't need to wear glasses, but just that in examination we have to rule out that whether we can put that lens for you or not. Yes, it happens because the eye structure, because the continuous eye pressure is more. It has been more big, and patient, if they are using eye drugs for a long time, slight morphological changes will happen. So for patients who have cataract and glaucoma both, we advise them not to wait too long for cataract to advance. So whenever it is significant to get operated, we start telling them that plan for a cataract surgery. So yes, it can cause. And whenever, suppose some patients have advanced glaucoma, so, and they are on maximum medication, even with pressures are not getting controlled. So some patients might end up in getting both glaucoma and cataract surgery and one visit only. No, actually not much. Just that since that crystalline lens was dim, no, once we plant a clear lens, they will feel glare for few days. That is why that black glasses we give, that whenever it's basically nowadays for protection, that whenever you are going out, nothing should enter or no injury should be there. That is a thing. But nothing like that. They can watch TV, they can sit in a normal light. Previously, they used to sit in a dark room. So that is not required. It's just that they will be more symptomatic because glare, they feel more, that clarity will come. No, see, some people will tell also, contrast sensitivity will change. Nothing like that. It's just basically, it takes complete 4 weeks for eye to become like a normal eye after surgery. So basically, why we advise wearing glasses, that same thing, injury should not happen. Nothing from outside should go, because the initial period is little sensitive. The wound will be open. Suppose if something goes, chances of going it inside eye, getting infected is more. So just as a preventable, depending how it is, the place, people understanding, accordingly, they will tell. See, it's basically a choice for the patient. What is the difference between a monofocal, multifocal, and trifocal? And nowadays, EDOF lenses are there. There are different varieties of lens. With monofocal lens, after the surgery, patient will have a minimal number for distance or no number, depending how the healing happens. But they have to compulsorily wear a reading glass. That is a monofocal lens. For other varieties of different like multifocal EDOF lenses, patients will not need glasses even for distance and reading. So it depends on the patient's need. Some patients will be like, we don't want glasses at all. So for them, we have to plan any of these variety of lens. Some patients, and also the package, like the payment of will be different, because these are premium lenses. So it depends on the affordability of patient. Then one more factor which is important, suppose if some patient has glaucoma or some patients has any retina issue, then we don't advise them to go for a multifocal lens. Because after they implant diagnosis, and for every checkups and all, the contrast will change for us also. So that is what I told you, that depending on the patient examination, we will tell them the options for lens. Suppose if everything is fine, then they can choose any of those. Yeah, it does. Multifocal lens, no, you are talking about bifocal glasses or the intraocular lens. So that is a multifocal lens you are asking. Yes, so generally lens will not cause any issue. It's just that multifocal lens, some patients do feel glare at night driving. So that is one thing. Patients who drive a lot, for them nowadays more premium variety of lens like EDOF, trifocal lenses are there, which will cause lesser glare or no glare at all. Then no, maybe she has some retina issues. Nothing. So generally patients will not complain. So maybe after checkup we can tell you, okay, what is the problem. Some patients, same thing what I told you. No. It's done. Yes, we can do, sir. Nowadays, different things. Suppose some patients do get number. There are like some places they are doing it. But again, doing a repeat surgery, secondary surgery, we have to evaluate patient completely, because same thing, chances of complications or any increase in pressure post surgery, second surgery, there are options. See, nowadays with the technology, there are all available options. Whatever you want, you will get it. Just that we have to evaluate the patient and see whether it is correct for them or not. Sir, not external. You have to put a lens inside. See, okay. Now, previously, I think long back, it was a thing that complete lens removal was there. Basically, there is a natural bag inside eye. So basically, we put in the same natural bag, we remove the natural lens and put an artificial lens. So same thing what I told, no, until unless there is absolute contraindication for some patients that we cannot put lens. Previously, what they used to do, previously I'm talking about the most primitive surgery for cataract. That time complete with the bag removal they used to, with the bag they used to remove. But nowadays that is not there. So when you remove the lens completely, then you have to put a very thick glass. But nowadays we have so much good technology that we can put a natural, in the same place where we have the natural lens, we can put an artificial lens. So either glasses, depending what type of lens you choose, suppose multifocal or EDOF, you won't need glasses after surgery. But with monofocal, you will need a reading glass or a minor number for distance for some patients. Sir, it is safe, just that patient's evaluation is very important for them. Like patients who are undergoing LASIK. Basically, LASIK, no, what happens in the cornea? I'll just show you with this slide. This part, the transparent part. So, LASIK, what this? Okay, it's not coming. The front part of the eye is called cornea. So basically in LASIK, what we do in the cornea with the laser, either we'll remove a small part depending on your number and put it back and it heals. So that your number refractive, basically it's a refractive surgery. Yeah. So depending if your corneal thickness is adequate, then you can undergo LASIK. It's generally, we again same thing. If patient has any glaucoma, any retina problem, depending on that we have to choose. So patient selection is very important for these surgeries. Generally it is safe, patients do well. See, recovery period, basically there are two varieties of lasers what we do. That is, one is PRK, one is LASIK. So you have to put drops 1 week after any eye surgery. You have to take precautions. After that you have to keep putting drops. That is there. And for 6 months or so we give lubricating drops for dryness, because that is something common after any corneal procedure. So generally the recovery time will be like 10-15 days. If you ask me for any eye surgery, it will come approx 1 month. You should take precautions. Yes, some patients do get, because see, it's a human eye. So whatever, how the healing happens, slight number, or some patients can get number again. No sir, preferably one eye at a time. So one eye settles, then maybe like depending on the cataract, 1 week or 2 weeks later we can plan for the other eye. No sir. Actually eye transplant, that is what, eye transplant is basically the cornea transplant. It's not the nerve or the retina problem. See, generally it can, generally what we see, no, it is bilateral. That means it affects both eye. But it is asymmetric. One eye can be affected more, less, but it can happen only in one eye, and the other eye is safe also, depending on the cause of glaucoma. Whenever you blink, no, the lubrication of the eye maintains. That is a thing. So suppose if you don't blink, your eye is continuously exposed, surface is exposed. So whenever you blink, the moisture of the eye gets maintained. If you don't blink, the layer which is there, no, because of evaporation and all, the dryness will happen. So that is why we advise to blink more. Yeah, so involuntarily, normally our eye, if you don't realize, we blink every minute. So whenever you are concentrating particularly on screens or reading a book continuously, the involuntarily blink of the eye reduces. Yes sir, we can do. Not the LASIK sir. LASIK is a different surgery. Laser cataract surgery, yes, we can go. Yes, yes. Because with the laser we will cut the cataract. The LASIK laser. Sir, no, particularly not. It won't, in case the retina problem is there from before, that will remain like this. Sometimes some patients who have hard cataract in 4th stage, no, they might end up getting swelling in the retina. That is common. No, nothing related, sir. See, you can undergo both the things. Just that retina it won't cause. Basically with the laser cataract surgery, what we do, certain steps of the manual cataract surgery are done by laser. So during cataract surgery with the machine, no, we will cut the lens into smaller parts and remove it through a small opening. So what the laser will do, it will cut the lens by the laser, not manually. So the manual manipulation will reduce with the laser. Yes, see, both the things are equally good. Both the things are good only. So with laser, the precision will improve. Phacoemulsification, you mean? Then you had pre-existing retinal problem, no? That is what I am telling. Then it is better to go for manual. Suppose if everything is normal, manual means there are two types of surgery. What sir is telling is manual small incision cataract surgery. Okay, and other is phacoemulsification. Phacoemulsification is with a small incision with a ultrasound probe we remove the cataract. With manual small incision, the incision will be little larger. Okay, but again coming to the femto, what laser you are telling, it is an advanced technology of phaco. Okay, so with the laser with a small incision we remove the lens, and again like few steps are done by the ultrasound only. Understood? There are 3. Both of you are correct actually. It is more technical. No, the phacoemulsification is a thing, sir. Phacoemulsification, it can be done manually also, like all steps done by the surgeon, and few steps done by the laser is laser cataract surgery. Phacoemulsification is manual, done with an ultrasound probe by a surgeon. All steps will be done by surgeon. With laser, few steps in the cataract surgery will be done by laser to give a more precision.
Things which people face. In general, people generally talk Triphala water to wash eyes. In naturopathy especially,
Okay.
they give every day Triphala water to wash your eyes.
I have not heard, to be very frank about this, so I cannot comment.
Okay.
Yeah.
What frequency you will ask for eye wash to with cup?
See, you don't need to wash eye. That is what I told you. Eye has a normal lubrication.
Yeah.
So, in case minor something goes inside and you feel, just wash it with a normal water. That is all. Generally, with a minor dirt and all, eye has a mechanism to get it clean itself. It doesn't need anything from outside. Some patients, when they do end up in like dry eye, that means their eye is secreting less water or they are not blinking. The eye has become dry. The tears are not sufficient to keep it moist or clean it. Then we give lubricating eye drops. That is also basically a supplement for the tears. That is all. Other than that, like personally, I don't tell anything.
Probably tell washing and drainage system inside the eye, probably can highlight that.
Yeah, so there is, so basically in the eye we have a normal like gland which secretes tears, and it maintains a normal lubrication of the eye, and the water drains in the nose. There is a passage through which it drains in the nose. That is a normal mechanism of eye. So when you blink, the water keeps flowing. It's a mechanism through which, like a physics basically, that it keeps opening and closing, causing a suction to keep the drainage going normally. So any blockage in that also will increase, like again the thing. So basically dryness is one thing that is there. Normal lubrication will be there. So if that is normal, you don't need anything.
Yeah. One more question is that people generally working with 2 or 3 screens, and many times these screens are different resolutions.
Correct.
Color combinations and all those things. Will that affect eyes?
Yes. So like same thing what I told for the computer vision syndrome. You should have an adequate distance from your screen. Like the height should be adequate. It should be in the line of the eye. Also, the screen brightness should not be too bright or it should not be too low, causing an eye strain. It should be moderate.
Yeah, sometimes each brand has their own color
Correct,
combination.
correct. So we can change it. That brightness part, they can change brightness contrast to the thing that is not causing them. Like it should not be too bright or too low. That is one thing I would advise.
And one more thing is people generally do some exercises, eye exercises to take off their glasses per number. Is that suggestible or?
See, what I tell my patients, there are some people who try Ayurvedic treatments also. See, if something is working for you, please go ahead. But basically, if you got an eye number, either it gets naturally resolved or with eye exercises it will not. Suppose if you discontinue glasses totally, only do exercises, it won't help. Because basically the eye mechanism is the light coming from outside, it has to focus on retina. Suppose it focuses in front or behind, that is how you get an eye number. We give a lens to focus it on retina. So with eye exercises, it won't, like physics wise, if you ask me, it won't help. Yes. Yeah, not eyesight, sir. It helps in maintaining only the lubrication. They are just supplement for your tears, but it will not help you maintain eyesight. Yeah. No, because it's an age-related change. Suppose if you get gray hair, operation done, that's okay. No problem. Because inside the eye we have operated cataract, the lens is put, everything is stable. It won't harm anyway. It's like a normal eye. See, if your screen exposure is more, yes, it does help now. But nowadays, screens, suppose if you have a good this thing, if they have the UV protection, the rays protection, then you don't need. Blink your eyes more often. If screen time is more, you are getting strain, you can try getting a blue filter. But mostly nowadays, screens are so good that they already have that protective layer. No, UV rays will be there. See, because the screens are there, UV rays will be there. But the screen protection is there. What I told you for the laptop, particularly blinking for the dryness, but it won't help for the UV protection. UV rays, most exposure will happen due to direct sunlight. I am not sure about the technical part of it. Yes, yes. I same thing I mentioned. Even while working, also whenever you are reading, lighting should be adequate. Because if you read in dim light or if you do anything in dim light, no, it will cause strain to your eyes. Basically, your eye muscles have to focus more. Huh. So generally, it is because of dryness. But sometimes in allergic patients also, they might feel foreign body sensation. So generally it is dryness. Mostly same thing what I told, nowadays it is screen time. Another thing, as you age, you might have noticed your skin becoming dry. So that is same thing, like secretions in the body will itself decrease. So age related also dryness is very common. No, just precautions is you can blink more so that the lubrication is maintained. If it is not helping, you can use lubricating drops. They are not harmful, they are just supplements for your tears.
Is headache a symptom only for glaucoma or can it be a symptom for any other eye ailment?
No, sir, it's not only for glaucoma, it can be in some patients who have. Same thing I told you, no, the eye is maintained by different eye muscles. Sometimes because of muscle weakness also headache can be there, or continuous strain also can be there. So we have to rule out different causes of headache. Also sometimes suppose stress, migraine, these are additional factors other than eye causing. Some patients do present us to an ophthalmologist with headache, vomiting sensation. When we do see their nerves, we see a swelling in the nerve. Basically, increase in pressure in the brain reflects in the eye. So then we send them through neurologist for reducing the pressure. So there can be different causes for headache, not particularly glaucoma. And also the main thing is number. Any other questions? Yes, so allergy basically causes eye irritation. So antihistaminics will reduce the eye allergy. So see, in India there are allergic tests, but what I tell my patients, if you do that in India, you cannot pinpoint and get an allergen. Particularly, most common is dust allergy or a pollen allergy. So the first treatment for any allergy, not particularly eye, skin also, or breathing problem, is avoid allergen. So suppose some patients have this tendency for dust allergy. Whenever you go outside, wear protective glasses, wash your eyes immediately whenever you come home, just to avoid that allergen. And suppose if it is in the initial stages, no, then we do advise antihistaminic and a lubricating drop to keep the eye clean. And suppose if allergy becomes more severe, sometimes we have to give steroid eye drops to reduce the acute phase and then maintain them on anti-allergic. That is allergic only. That is not advisable. No, no. It changes the front part, the cornea, no, structure at a very microscopic level. So that we don't advise. Sometimes what happens if you do excessive rubbing, suppose something is there inside the eye, it got stuck. So that will cause lot of scratches on the cornea. It will unnecessarily complicate. So you should never rub your eye too much. Instead, wash it with water. Suppose something is there, it will come off. And one more thing, like tell my patients, and which is very responsive, that whenever suppose itching is more, put ice pack. That helps a lot. It will reduce your itching. Okay.
Thank you so much, Dr. Nimisha. It was a wonderful, insightful session. And from the queue of questions that we were getting, I understand it was a very topic which is of interest in today's time. So once again, many thanks for taking this up for our audience today. So we would now proceed with a short video. Like Sister said, meditation is one of the tools that can also impact how our eye health is also there. So we have this short video developed from Manmohini Divine Studio located at Shanti Sarovar, ideated at Shanti Sarovar. So this short video will inspire you to pause and take out time for yourself and reflect. Let's have this video and then we'll proceed to the next. Oh no! Oh no! Forgot again.
It's okay. Now, let's take a moment to pause and simply be yourself. Remind yourself that this is life, right here, right now. Remember that life is precious and fragile, hence, it is to be lived in love. Remind yourself that whatever is happening in your journey, it is all as it is supposed to be. Now, let's experience our true self, our true identity. I, the ruler of this body, sitting in between my forehead. Now, let's connect to the ultimate source of peace, the supreme energy. Realizing my true peaceful self.
So, I hope you enjoyed this attempt at animation from Manmohini Divine Studio, and more such videos will be made and are already being made, which are like interviews and certain short stories, motivational stories, like you said. So everything is available on shantisarovar.hyderabad. That's a YouTube channel of Shanti Sarovar. You can look it up. Even recordings of past sessions of Sunday evening talk are available. Even today's session will be available on YouTube, so you can share it with your friends and relatives to create the awareness about eye care and especially glaucoma and cataract. So this is something I believe you all can benefit from. To give the closing remarks, I will now invite Sister Vasanta, and we will have a few remarks. So Sister Vasanta, who is a senior faculty here and has been coordinating Sunday talk, bringing us new topics every week. Thank you.
Om Shanti. Have you taken a pause? How many times did you take pause in the whole day? So one thing is eye awareness, eye care awareness, which we learned from Dr. Nimisha. Thank you very much for the wonderful talk, as well as I have seen the flood of questions from the audience, so that has given a lot of insights for all the questions. So thank you very much. So how we take this 20-20-20 rule to keep our eyes good? So what is the rule to keep your mind peaceful? Pause, right? So that is the rule for our mind to be peaceful, to be contented, to be happy, and having lot of stresses, but still taking time for yourself so that you can work better, right? So is that okay to take pause 1 minute every hour? Possible? Possible? Right. So we are not so busy that we cannot take time for at least a minute for an hour. So every hour, if we take 1 minute of pause for our own self, then we can better focus. So every time your eyes are not good, we do, and then we see clearly, right? Because your focus is again good. So in the same way, our mind also to be focused, so we have to take a pause. So thank you very much, Dr. Nimisha. It is said, Sarvendriyanam Nayanam Pradhanam. So we have to take care of them because it's very fragile, right? And very deep, care is needed for eyes. So let's take the eyes to see good also. Yeah? दिखाते हैं ना? Don't see evil. Yeah? 3 monkeys? Yeah? What are the 3 things? गांधी जी भी दिखाए थे 3 चीजें. क्या क्या नहीं करना है? बुरा ना देखो, बुरा ना बोलो, बुरा ना सोचो. तो बुरा ना देखो, सब कुछ इससे ही होता है. इसीलिए दृष्टि, नज़र, एक तो नज़र अच्छी के लिए भी है और बुरी दृष्टि भी जो होती है उसको भी नज़र बोलते हैं, है ना? उसको भी निकालते हैं. दृष्टि तीसर नज़र निकालते हैं तो अच्छी दृष्टि हो जाती है. तो दृष्टि का बहुत महत्व है ना? तो आंखें कैसे आप देखेंगे उसी अनुसार आपके मनोस्थिति भी बनती है. दैट्स व्हाई इट इज सेड इन इंग्लिश, आईज एंड ईयर्स आर द विंडोज फॉर द सोल. राइट? तो आप जो देखेंगे, जो सुनेंगे, उसी अनुसार आपकी चिंतन, मनन, मंथन सब कुछ चलता है. तो आज सिर्फ ये आई केयर फिजिकली कैसे रखना है, इसके साथ साथ हम ये भी प्रेरणा लेवे कि भगवान ने बोला है कि हमको बच्चे अच्छा ही देखो. तो क्या देखना है? अच्छा देखना माना क्या देखना है? यहाँ ब्रह्मा कुमारी इसमें हम सिखाते हैं और हम वही प्रैक्टिस करते हैं कि सब में गुणों को देखो. थोड़े दिन पहले हमारे डिस्कोर्स में ये भी बताया कि दत्तात्रेय का एग्जाम्पल. दत्तात्रेय ने क्या किया मालूम है? उनके आजू बाजू में 24 वैरायटी एनिमल्स दिखाते हैं और कहते हैं सब में गुण देखता था दत्तात्रेय, है ना? तो हम भी देख सकते हैं ऐसे. बच्चे हैं, बड़े हैं, ऑफिस वाले हैं, घर वाले हैं, पूरा टाइम उनको क्रिटिकल दृष्टि से ही देखते हैं या बुरी दृष्टि से ही देखते हैं. तो आज वो भी एक इंसाइट ले लेंगे कि ये आँखों को अच्छा देखने के लिए भी यूज़ करना है, तब आपकी दृष्टि भी अच्छी रहेगी, ये आंखें भी अच्छी रहेगी और साथ साथ मन की दृष्टि भी. मन का नेत्र कहते हैं ना, मन का नेत्र कहते हैं ना, तो वो नेत्र भी ठीक रहेगा. ठीक है? तो a big thanks to Win Vision Hospitals. So you have come here and spend your time and giving your valuable advice or time here. So I would like to acknowledge Ram Krishna Garu, who is instrumental to bring Dr. Nimisha here. Thank you for that kind gesture. So we'll all take care of whatever you have said. So thank you. I request Madhavi sister, please come. And I also request Dr. Nimisha Garu. And Ramakrishna Garu, please come. Please come on the stage.
So, Sister Madhavi is acknowledging and giving a token of love from Shanti Sarovar. So, this. Yes. Thank you so much, Dr. Nimisha, for the wonderful session and inviting Ramakrishna Garu. We are grateful to you for arranging this session with WinVision. Dr. Nimisha, sister, if we can have a group photo and if the participants can not okay. So, Dr. Nimisha and Ramakrishna Garu for the group photo.